Hello everyone, we are back again with this video where we're gonna tell you about zero to Australia. So if you're starting from scratch, that means zero, we'll tell you how to prepare and what you have to do to prepare, to clear MC1, to make your CV and get a job. So this is the video you need to know everything about AMC pathway and your journey to Australia. So when you're preparing for AMC1 and you don't know anything, there are two methods you can prepare for this exam. First is self-study, which Arushi is gonna tell.
Yeah, so if you're opting for self-study, there are a few resources that you can use, like John Murtagh, Redbook, ETG, up-to-date guidelines, as well as RSCP guidelines. Once you've made your own notes through these resources, you can use various question banks. So there's things like M+X, Amidex, but if you want a relatively more pocket-friendly version, you can use things like our Telegram group and some other various free groups available online.
Yeah, Facebook, Telegram, there are so many recourse groups, you can use them. But if you need any assistance or help, we are there. There are so many coachings, but we are different. We have told in our previous videos why we are different, the quality of mentors, the quality of classes and notes. So what we do is we provide you the crisp and concise notes from all the resources we mentioned. You don't have to read any of those resources, just read our notes. Practice the questions that we give. Any doubt, solve with our mentors, ask the doubts. And this is a 3-month course with a 3 month of extra access. So 6 months is enough for total preparation. You can take the exam in 4 months, 5 months, 6 months, whatever you like. With self-study, you will definitely need 6 or maybe more than that. So choice is yours. We are not saying that you join this or that, but this is the protocol you have to follow. Self-study or join any coaching and practice questions and finally clear AMC1 exam. Now, the step 2 is you're gonna clear the English exam. There are 3 English exams. I would recommend PT, OET and IELTS. So OET is more towards medical side, so bit easier if you are not good at English, but it is expensive. It costs around 40,000 Indian rupees. But if we talk about PTE and IELTS, these are cheaper exams, around 20,000 rupees each exam. I would recommend PTE because the PTE result is on the same day or the next day and it's easier. Go for PTE. So you have cleared AMC1, you have cleared PTE, start applying for jobs. Okay, when you're applying for jobs, what things you have to keep in mind, Arushi is gonna tell.
So there are various ways for you to apply for jobs. One most important and common way to apply is through campaigns. To keep in mind is that campaigns open at a specific time during the year, so you'll have to go through the websites and see at what times these campaigns open. For some people it's difficult to keep a track of these timelines, so we do offer help to such candidates. You can reach out to us and we can let you know more about it. But if you want to do it on your own, so I would say go with campaigns, otherwise apply for individualized jobs through Seek and Indeed websites.
Yep. So when you are applying for jobs via these campaigns or Seek or Indeed, and finally you are lucky enough to get a job interview, the interviews are a bit tricky here because the questions are not only clinical, they'll ask about more ethical side or the approach to the patient or a difficult situation with a colleague or patient's family member. So these kind of questions, you can go through various Facebook groups to find the questions they are asking in those specific hospitals and what kind of question they're asking. You can watch our previous videos to know about interview questions and how to answer them. But if you still need any help, we provide one-to-one sessions as a mock interview. You can attend that at this website. Okay. Now, what if you don't get any job and you are still applying for hundreds of jobs, because that's possible, lots of competition and the process is a bit slow. It will take around 5 to 6 months to get your first job offer. In that period, don't just sit and wait. Start preparing for AMC2. For AMC2, you have to go very clinical. It's a passing rate is low, but it's a doable exam. So watch some YouTube videos, and there are Facebook groups, Telegram groups telling you the scenarios. Read the AMC handbook of clinical cases, should be enough, and attempt AMC2. But if you are lucky enough to get a job interview and the job offer is there, then what you have to do is
you have to make sure you do really well. So once you've cleared AMC2, the chances of you securing a job increase significantly. Most likely, many of you might just land a job in a matter of 6 months or so.
Yeah, so final journey is from 1 year to 2 years to come to Australia. So don't think that you'll be coming to Australia within 6 months. That's pretty unrealistic. So give yourself some time. Come to Australia in 2 years, and if you are one of those lucky students who are coming to work as a doctor in Australia, don't you ever think about finances. And the money you'll be earning as a junior doctor, even as an intern, would be more than sufficient to sustain yourself in the Australian healthcare system. So you don't have to take any money from your parents. You might be sending them some money if you like, but yes, even if you have family, you are an intern, the money is good. If you want more details about the salaries and expense and everything, watch this video on YouTube and you'll know everything about the expense and salaries. So I hope this video is helpful for you and you'll follow us from there. Follow for more.